Looks like you've been thinking about body sculpting and you want to know which kind of procedures is best. Like most things in the aesthetic space, there is no single one answer that's great for everyone. But let's see if we can give you some information to narrow it down for you and your needs. Determining the most effective form of body sculpting highly depends on your individual goals, the specific areas being targeted, the amount of fat to be reduced, and personal health considerations. Different body sculpting techniques excel in various aspects, and what works best for one person might not be ideal for another. Here are some of the most popular methods and their notable features in my extensive research on these devices. Cryolipolysis, also known as cool sculpting. This non-invasive method freezes fat cells, which are then naturally eliminated by the body over time. It's best for targeting specific areas of fat that are resistant to diet and exercise. Results are not immediate, but can be seen within a few weeks to months after the treatment. I'm not personally a fan of this type of body sculpting, and if you look around, you will see I'm not alone. Besides the uneven results you can often see with cryolipolysis, there have been some highly publicized cases of significant disfiguring as a result of the procedure. Laser lipolysis, also known as sculpture. This technique uses laser energy to heat and destroy fat cells. Like cryolipolysis, it is non-invasive and designed for spot reduction rather than significant weight loss. Results typically appear over several weeks as the body processes out the dead fat cells. After treatment, some patients experience some soreness and stiffness. You may also see some bruising in the treated areas. Radiofrequency or RF treatments. Some devices, M-Sculpt and the TrueSculpt ID. RF treatments use heat energy to target and destroy fat cells with an added potential benefit of skin tightening in the treated area. It's a non-invasive option that also requires time for results to become visible as the body eliminates the affected fat cells. I have a lot of experience with both the M-Sculpt and the TrueSculpt ID devices here in my office, and we do several procedures daily. The feedback I get is RF treatment is not too bad for most patients, but we get slightly more complaints during this TrueSculpt ID versus the M-Sculpt machine. We do have the ability to dial in the temperature to the patient's comfort level, but there is a target temperature that is ideal, and I've noticed the most results when we get to that temperature. Ultrasound fat reduction. An example is the UltraShape. This method uses focused ultrasound energy to break down fat cells, particularly in the abdomen and the thigh areas. It's non-invasive and targets fat without harming surrounding tissues. In my opinion, the results with ultrasound therapy is not as consistent as the previous modalities. High-intensity focused electromagnetic therapy, HIFEM. A great example is the M-Sculpt. HIFEM technology induces powerful muscle contractions not achievable through voluntary workouts. While it primarily aims to increase muscle tone and strength, it also offers fat reduction benefits. The M-Sculpt is unique in that it also provides HIFEM and RF energy at the same time. This produces a double hit on fat and muscle tissues at the same time. This can save time and provide great results in a short period of time. Liposuction. Now, if non-invasive methods are not effective or patients require faster results or are unwilling to put in the effort of a clean diet and exercise program, the tried and true surgical option is liposuction. This involves physically removing fat from the body with a cannula under general anesthesia. It can provide more immediate and noticeable results compared to non-invasive methods and allows for the removal of larger amounts of fat all at once. However, it comes with significantly more risks, usually associated with surgery, such as anesthesia, a longer recovery period, and potential complications in comparison to any of the non-surgical options I've already mentioned. The effectiveness of these methods can vary based on the individual's response to treatment, the skill of the practitioner, and adherence to post-treatment recommendations. Non-invasive treatments often require multiple sessions and maintenance treatments for optimal results, whereas surgical options like liposuction offer more immediate and noticeable changes, but with a much higher risk profile. Consultation with a certified physician experienced in non-invasive body sculpting or a board-certified plastic surgeon if you are considering surgical liposuction can help determine the most appropriate method based on individual needs, lifestyle, and health status. I could go on for hours, but I think that's a basic knowledge you need for body sculpting and all you need for an informed decision on which might be the best for you. Of course, consult a physician for your needs. Every time I say cannula, I think of a cannoli. See you soon.